Hi, my name's Amar Ghattaura. I'm a consultant plastic surgeon working at the Sancta Maria Hospital. My specialist interest is breast surgery, and that includes both cosmetic breast surgery and reconstructive breast surgery. Firstly, it depends on the appearance you're trying to achieve. So if you want to try and achieve a more natural look, then perhaps an implant placed below your muscle would achieve that better. If your goal is more of a synthetic look, then perhaps an implant above the muscle would do better for you. Occasionally there's times when I'll say that the best place for the implant is always underneath the muscle. And that would be if you have very little breast tissue on the upper half of the breast. And in that case, you're trying to disguise the appearance of the implant as much as possible. It does up to a point. The size of the implant you can put into a breast depends upon the skin envelope, so how tight your skin is above it. If you don't have much breast tissue, then getting in an implant becomes difficult. If you have loose skin above the breast, then getting in a larger implant is possible. But on the whole, with a very small breast to start with, a small or medium-sized implant should do very well. Actually, there's no set date on how long an implant will last. The reasons why you might need more surgery in the future is if you develop a problem. And problems can be a rupture of the implant or something called capsule contraction, and that's where the scar tissue around the implant becomes quite hard and misshapes the breast. The actual most common reason why people might need more surgery in, say, 5 or 10 years is because the breast tissue around the implant changes. So perhaps the breast droops, or the shape changes, or you would like to enlarge or reduce the size of your breast. This normally happens at about 5 to 10 years. Yes, you can breastfeed if you have breast implants. There's no evidence that it causes any harm to you or to the baby. In terms of how the breast shape changes, there will inevitably be some changes when you go through pregnancy, and particularly if you breastfeed during that time, as the breast and the skin stretches. After you stop breastfeeding, the volume of the breast reduces, and sometimes the skin does not retract back and can lead to some droop afterwards. Yes, doing a combination of a breast implant and an uplift at the same time is a fairly common procedure. It works well for ladies who've had breast droop over the years and lost some volume. So the implant increases the volume and the uplift tightens the skin overlying. It's important to remember that the reason why the breast is drooped is because the skin has stretched, and even though you tighten it up and you put an implant in, over time that same skin will stretch again and you may end up with droop in the short or long term.